Good afternoon. Our article in media coverage is the article entitled Special Education Advocates Focus on Funding, Mental Health, and Teacher Shortages. This is a great concern for social workers as we are to help people to meet their most optimal situations. This article states that the field is struggling with teacher and staff vacancies, as well as growing demands for CEC and CASE members say this. Now, CEC is the Council for Educational Children, Exceptional Children, and CASE is the Council for Advancement and Support of Education. The policies or legislation that is in fact will be discussed after I share with you more about this article. This was a summit that was held in Alexandria, Virginia. These individuals came together because they were going to Washington the end of that week so that they could ask for legislation that would support and increase funding and even bonuses that would get teachers interested in special education. According to the National Center for Education Statistics, 70% of survey schools report special education teacher vacancies 2023 through 2024. About 50% of special education teachers leave within the first 5 years of teaching. Okay, maybe that didn't hit you, but how about 7.5 million students were identified with disabilities in 2022 through 23, equivaling about 15% of pre-K, elementary, and secondary student populations. There is a growing need for intervention. There is a growing need for services to be had by these children. Um, Part of the thing is when you look at the support for a bill, that is what they are asking for as far as mental health is concerned. The Creating Access and Resource in Education for Student Mental Health Act. This measure would authorize two grants under the Bipartisan Safer Communities Act to increase the number of school based mental health professionals. When I say mental health professionals, I'm talking about not only um, the teachers, but we're talking about social workers, psychiatrists, counselors, psychologists. We need more to happen because this is critically important. These are the children that are going to be the leaders, not of tomorrow, but in a few years. And if we don't have enough people to help these individuals to navigate through their crises, mental health crises, disabilities, then we're handicapping our future. Now, that was the article, and of course, they were going to go on to more information about the fact that, according to a Government Accountability Office report, there is a snowball effect when staffing shortages include of teachers, psychologists, counselors, and social workers result in some students receiving delayed services, support, or services not at all. Now, we're going to move into the second part of this. Now, when we talk about the policies that would respond to this problem, we have the Americans with Disabilities Act, ADA, which was signed into effect in 1990 by President George W.H. Bush. I thought it was interesting also to see if these were Republican presidents or Democrat presidents. Now, with Mr. Bush, he believed in civil rights actions. So his signing that act, which gave people with disabilities employment, public accommodation, transportation, telecommunication, and commercial facilities, abilities to handle them so that they could go to a restaurant, so that they could go shopping, so that they could get on the bus, so that if they had a disability, a physical disability, unable to use their hands, hearing, then telecommunication efforts were needed. Another policy that was involved is Individuals with Disability Education Act, IDEA. This was signed by President Gerald Ford in 1975. He too was a Republican. Now, the issue with this one, he felt that this act would put a strain on the federal resources, raise false expectations of support, and possibly contained unwise provisions. But he knew that this had to happen. This act assisted not only the children, early intervention, special education, it protected the parents' rights as well. So his signing of this helped them with education, to be able to have IEPs, to be able to have 504s, to be able to navigate through school. The latter one is the Developmental Disabilities Assistance and Bill of Rights Act, DD Act. That was signed in 1963 by President J.F. Kennedy, which was a Democrat. This policy, this act, made public places more accessible. Now, that was in 63, but when Mr. Bush in 1990 signed his, it extended the help and the accountability of individuals that owned services to provide accommodations for people with disabilities. Now, the strengths in these policies is that somebody stood up and said that these people need help and that we are going to fight for it. The reason why this article came up important to me is because we still have not arrived there yet. That is one of our weaknesses. Yes, the ADA is in effect. Yes, IDEA is in effect. Yes, DD Act is in effect. But there are still shortages. There are still areas that are not being addressed. The need for professionals like us in this, they're not making it attractive. They offer special incentives for people to work in inner cities schools, but they're not offering incentives for special need teachers to assist these children. Recommendations, as you can see, according to the article, they're asking for increasing funds, for incentives for people to be wanting to do education for special needs, so that these children can get services, so that they can have their IEPs timely. As a matter of fact, in Birmingham City schools, personally, I know, both from working and from my family, that many IEPs do not get done unless someone pushes. A lot of parents don't know how to push. Foster parents don't know how to push. Therefore, social workers have to try to get this for them. This was a very interesting article, and my research proved to be very enlightening. I hope this was enlightening for you as well. Thank you for your attention.